People often say to me when we're talking about their improvement projects, the thing that holds them back and worries them is the collection of data. They understand the point when I say, well, everybody who does a job also has to be able to improve the job. They can see what they want to improve, they can see the initiative they want to fulfill, they can see the thing on their ward round or in their practice or in their consulting room that needs to be changed. But they hesitate because they hear about data collection. They know in the PDSA cycle you've got to do a bit of studying and acting upon what you find. And they think it has to be complicated maths or big spreadsheets with lots of data and process control charts and various other things. Well, it doesn't. The point about the data is it can be incredibly simple. Only this morning I was talking to a GP who said they'd started their 5S program by having a whole skip load of junk that they'd chucked out from the practice. Well, a photograph of that skip would have been data. And let me show you another simple data collection technique. Okay. You might have heard of people talking about a spaghetti chart. Well, what's one of those? And here is one. It's just a simple piece of A4, and on that A4 you draw your work. So let's imagine, for example, you're working on a ward and you might draw on your spaghetti chart a kind of diagrammatic representation of the ward. Say there are 3 bays, a treatment room, the nurse's station here, and a couple of storerooms, one for linen and one for equipment. You very simply draw, say in this example, they're 4-bedded bays. So, and you don't have to be Michelangelo, you don't have to be a clever artist. The important point about this is you're collecting some information about your work. So you'd start with a picture of how you work. And this could be a picture of just a single room. It could be your office. It could be a picture of part of a workstation, like the Bay Area here. It could be the ground floor of an entire practice. It could just be a picture of your kitchen and you're trying to sort out what you do with the kitchen. Then the data collection is very simply drawing on your little chart here the movement of either you or the person you're working with to do the improvement, and watch what they do. So they might start out at the nurse's station, go to a bed, do a few things with the patient there and go to the next bed. However, at the next bed they realise that they haven't got what they need and they go to the storeroom, they pick it up, they go back, they think about what that patient needs with that thing and they realise actually there was something else they need, that's in the other storeroom, they go back, they move around a bit, they go to the 3rd patient and take the 3rd patient to the treatment room. They do various tasks in the treatment room but realise something else is missing and have to go back to the storeroom, go to the treatment room again, take the patient back, go to their 4th patient. Meanwhile, they have to go back to the nurse's station, answer something, collect some notes, go back because they picked up the wrong set of notes, go back, do something with the patient, find they haven't got what they want, and so on, and you get the idea. And instantly you see why it's called a spaghetti chart. This is data. After your improvement, maybe you've made sure that in the end of each bay, for example, could be a standard set of the equipment you use most often, or in each bed area there could be, after your improvement, where you've stored something and you do set off, do the task, do the task, do the task, do the task, you've finished. And the difference between the blue lines of spaghetti and the simple red line is your data. It is both how you visualised the improvement being needed, the blue spaghetti, and it's an evaluation of your improvement. Look how much time I now no longer waste because of the improvement. So it's data to both visualise the improvement and its data for the evaluation, one piece of paper, one sketch and a few lines. Data collection can be really simple.